With age comes wisdom. However, so do falls that can lead to fractures. And one of the most common injuries we see in older adults is fractures of the femur near the hip. To understand why this happens, we need to understand how the femur is built, where forces are distributed, and how it connects with muscles around it. The femur is the next bone in our lower limb skeletal series. So in this video, we are going to break down the full anatomy of the femur, going through its parts, surface landmarks, and muscle attachments. And as always, I will highlight some important clinical correlations along the way. What's up everyone, my name is Taim, I'm a medical doctor and I make animated medical lectures to make different topics in medicine visually easier to understand. If you'd like a PDF version or a quiz of this presentation, you can find it on my website, along with organized video lectures to help with your studies. Alright, let's get started. This is how I understand everything regarding the femur. I start by dividing it into a proximal part, a body of the femur, and a distal end. Let's just orientate ourselves first. The femur we're looking at now is the posterior view, and here on the left side of the screen is the anterior view. Let's now isolate the bones and start with the proximal part first. The first structure we see is the head of the femur. It's this smooth, rounded part that forms part of the hip joint. Just beneath that, narrowing off, is the neck of the femur. And this is a really important region because this is where a lot of hip fractures in older adults tend to happen. Let's now add the femur back into the pelvis and see this in context. You can now see how the head of the femur fits perfectly into the acetabulum, and surrounding the head and neck, we've got all the ligaments and the capsule that make up what we call the hip joint. Now, if we look at the medial side of the femoral head, you will notice a little indentation. That is the fovea of the head of the femur. And the hip joint actually has a small ligament that attaches right here. It's not the main stabilizer of the joint, but it does carry a small artery that is important in early life. So, in context, here you see the femoral head sitting inside the acetabulum. I have faded the hip bone a bit so you can see this more clearly. And right here, you can see how the ligament of the head of the femur attaches to the fovea. Another thing is, the head of the femur actually articulates with the lunate surface of the acetabulum, and in this space right here, it's cushioned by the acetabular fat pad. If you want to learn more about the hip joint in detail, I've covered that in the previous video, so feel free to check that out, but let's move on and continue with the rest of the proximal femur. The next structure we can see is a greater trochanter. The greater trochanter is a really important part of the bone because so many muscles from the hip insert right into this area. You can see here, we've got the gluteus medius, gluteus minimus, piriformis, superior gemellus, inferior gemellus, and the obturator internus. All of them attaching right into the greater trochanter. But if you look closely, you will see the greater trochanter also forms something called the trochanteric fossae. What's interesting is, right on the opposite side of the obturator internus, we can see another muscle called the obturator externus. If we just tilt the femur slightly here, you can see how the external obturator muscle inserts right into this fossae. Now, since we've got a greater trochanter, we also have a lesser trochanter. This is a smaller bony bump located on the posterior medial side of the femur, and it serves as an insertion point for the iliopsoas muscle, which is the main flexor of the hip joint. So every time you lift your knee or flex your thigh, this area is getting pulled at. The next structure we can see is the intertrochanteric line. You will find it running diagonally on the anterior surface, connecting the greater and lesser trochanters. It acts as an attachment site for the capsule and the iliofemoral ligament of the hip joint, and also gives origin to parts of the vastus medialis and the vastus lateralis muscles. On the other side, the posterior view, we can see the intertrochanteric crest. This is a more prominent ridge that also links the greater and the lesser trochanters, but on the backside. And there's a small bump along this crest called the quadrate tubercle, and that is where the quadratus femoris muscle inserts. So those are the main features of the proximal part of the femur. Let's now move on to the femoral shaft, and for now, we will focus on the posterior surface. Starting from the top again, here is the pectineal line where the pectineus muscle inserts. Just lateral to it, you will see the gluteal tuberosity, that is where the gluteus maximus muscle inserts. Both of these landmarks are pretty easy to remember because they're named after the muscles that attach to them. Running down the posterior shaft is a long, rough ridge called the linea aspera, and it is made up of the medial lip, a lateral lip, and an intermediate zone in between. As we reach the lower third of the femur, the linea aspera splits into two ridges, the medial and the lateral supracondylar lines. Now, let us move back up again. Here we see the pectineus muscle attaching onto the pectineal line, and here is the gluteus maximus inserting onto the gluteal tuberosity. Now, around the medial lip of the linea aspera, you've got the attachment of the medial intermuscular septum, the origin for the vastus medialis, and the insertion for the adductor longus, adductor brevis, and the adductor magnus. I have faded the adductor magnus so you can slightly see the outline on this model. Along the lateral lip, we've got the lateral intermuscular septum, the origin of the short head of the biceps femoris, and the vastus lateralis. The intermediate zone runs between these two lips, and while it's not a primary site for major muscle attachments, it forms a central portion of the ridge as it continues down the shaft. The medial supracondylar line gives attachment to the adductor magnus muscle, and the lateral supracondylar line gives origin to the plantaris muscle. So that's these landmarks. Other surfaces you will come across on the posterior view is the posterior surface of the femur up here, and you will also see the popliteal surface down here towards the distal end. Then we have a lateral surface and a medial surface, and if we now focus on the anterior view, you will notice two distinct borders here, the medial border and the other called the lateral border. Between these two borders lies the anterior surface, which gives origin to the vastus intermedius muscle, one of the quadriceps muscles. Alright, that was everything for the shaft of the femur. Let's now move down and look at the distal end. So let's go ahead and zoom in. The distal femur consists of two large rounded areas, the lateral condyle and the medial condyle. These are the weight-bearing parts that articulate with the tibia and the patella at the knee joint. Let's start with the medial side. The medial condyle has a medial epicondyle on its outer surface, and just above that we find the adductor tubercle. The adductor magnus muscle inserts right onto this tubercle, while the tibial collateral ligament attaches more inferiorly on the medial epicondyle. Also attaching here on the medial condyle is the medial head of the gastrocnemius muscle. Now, moving over to the lateral condyle, we can see the lateral epicondyle. This is where the fibular collateral ligament attaches. And just below that, there's a small groove called the groove of the popliteus. The popliteus muscle runs right through this groove as you see here. The medial condyle is also where the lateral head of the gastrocnemius originates. So those were the main bony features and muscle attachments around the condyles. A few more things to mention. Between the condyles on the posterior side is the intercondylar fossae, and just above that is the intercondylar line. On the anterior side, you will find the patellar surface, which is a smooth area that articulates with the patella to form part of the knee joint. Now, when you look at this, there is a reason the femur is not straight. It has this natural curve and angulation that helps it handle and redirect forces more efficiently as we move. When we're standing or walking, forces travel through the femur in two directions, from the hip down under the body weight and up from the ground through the tibia. That curve the femur has actually causes the stress to concentrate in certain zones, like the femoral neck and the condyles. These are the major energy transfers areas in the bone, structurally reinforced to handle loads, but also more vulnerable to fractures, especially in older adults. And that was everything I had for the femur. Its landmarks, surfaces, and muscle attachments. In the next video in the lower limb skeletal series, we will be covering the joint right in this region, the knee joint, how it's built, its capsule, the different pockets, and the most common injuries. Click the next video and I will see you there. If you want handmade PDF version of this lecture, take a quiz to test your knowledge, or access an organized list of all my videos, you will find everything on my website. Thanks for watching, see you in the next one.